Welcome, former administrator. I'm really excited to get into it. We have a lot of questions. A lot of things been going on. So, in your first interview since you left CMS with our colleague Kelly Hooper, you said that you were proud of strengthening Medicare, Medicaid, and Obamacare insurance coverage. There's some big changes potentially on the horizon. Congress is debating shaving down the federal matching rate, administering a per enrollee cap on funding, and potentially the expiration of the subsidies. What concerns do you have with these moves, and how could they impact coverage?
Well, thank you for having me here. And I will start by saying I am indeed really proud of what we were able to accomplish over the last 4 years, mostly because I think that CMS's important role in making sure that people have affordable coverage really leapt to new bounds. I mean, with the implementation of Medicare prescription drug negotiation, it made a real difference in the lives of seniors last year and this year. When we look at the Medicaid program, which you heard Senator Baldwin really talking about, Medicaid has changed in its importance to people, to states, and really to the economy. And I think that that is something that is really important to me for people to really understand. I did a lot of work as a CMS administrator of talking to hospitals across this country, and there is a big difference in the state of the hospitals where they had expanded Medicaid versus those that did not. And so when I think about that, and then ACA coverage, Affordable Care Act, marketplace coverage, we went from 12 million to 24 million Americans. It made a real difference in our uninsured rate and the health of the nation. So as you asked, when I listened to some proposals to think about reducing those gains, I think it's really important for the American people and certainly for policymakers to understand just how important these programs are to the people that benefit from them, but to the doctors, the nurses, the hospitals, all of the people that provide care to us across this country.
Great, thank you. And I wanted to get your thoughts specifically on one of the initial moves that the Trump administration has made, which is cutting navigator funding for Obamacare navigators from nearly 100 million to 10 million. You increased that funding during your tenure, and can you tell me, why navigators are important and what these cuts could mean?
The Navigator program really was designed to do even more than just helping people to enroll in coverage. These are neutral people who are helping to enroll some of the most underserved in our country. So they provide, in addition to helping people to choose Affordable Care Act coverage or Medicaid if they're eligible, really educating people about how to use their coverage. I think we all can speak to how difficult sometimes navigating the insurance market can be. And so when you think of some of the people that come to our country or who are new to health insurance and needing to understand what deductibles are, at the beginning of my tenure, we were still in the COVID-19 pandemic, and I met with a lot of stakeholders as we were trying to talk about how to encourage people to get treatment, et cetera. And I really heard, as well as did other policymakers, of the importance of trusted messengers. It's not always the government, we know, who is the best messenger. It's often your faith leader, your houses of worship, your community center. And that was a lot of the interest in supporting the Navigator program. And so to say what are my concerns, I think the Navigator program provides really helpful backbone that's, again, broader than just getting people to have a card in their pocket. It's about making sure people actually see the doctor. I
wanted to transition to the Department of Government Efficiency, DOGE, of course, for short. We're still in the wake of several of massive layoffs across health agencies over the weekend, and CMS was not spared. There were, especially, I think, Politico reported about 80 people that were laid off from the Consumer Information and Insurance Oversight Division. Can you tell me how a little bit about the division, which I don't think is the most well-known, part of CMS, and what a cut of that magnitude could mean for its work.
So just to say, and I know that Senator Baldwin spoke to this is so heartbreaking to me and to other leaders, and I am so upset about just the way some of my former staff are being treated in this moment. And I think that not only is this no way to treat people, but it's also, again, damaging to the American economy. So CMS, there are reports of cuts to a couple of the offices. But what it is my understanding is that those cuts were more broad than just those two offices. Those are just what's being reported in the news, and there needs to be more transparency. CMS is a very interwoven agency. It's not, you can't just say one center works on Medicaid or one center works on Medicare. There are many offices that work on Medicare and Medicaid and make sure that people get their claims. And so indiscriminately firing people based on their status, being temporary without regard to what they do is incredibly damaging. There are people who work and make sure that when your nursing home has a problem, that we get those individuals to another nursing home, that when the hospital closes because something happens, that they get there. And those people also may be having been let go. And I think it's really important that there be more transparency about why and what is happening. To your question about CSIO, CSIO is an agency within CMS that oversees several things. It oversees the Affordable Care Act, which includes getting people enrolled in coverage, making sure just some of the things we talked about, but it also includes making sure that your insurance programs provide what they are legally responsible for, as well as implementing the No Surprises Act, which is a bipartisan bill to make sure that when you go to have a surgery that you're not surprised. And so that is the role and responsibility of CSIO. But again, I want to say more broadly, there are so many people that work at CMS whose names you don't know, whose offices you don't know, that make sure that Medicare beneficiaries get what they need and make sure that all the doctors and nurses and hospitals in this country that depend on the Medicare program get paid.
So DOGE is targeting waste, fraud, and abuse, which there is a fair amount in the Medicare Medicaid program. Can you tell me a little bit about what you did during your time to try and rein in this type of fraud and waste in these government insurance programs? And is DOGE on the right track based on the initial moves that they've made?
So it is always the responsibility of leadership to really look to make sure that Medicare, Medicaid, and of course more broadly that the federal government is spending dollars wisely. And certainly fraud and abuse is always going to be an issue. It is something that we certainly took very seriously and engaged in. And I would say just a couple of the things that have come up, we see in the fee-for-service space, often we'll see an increase that comes out of the blue for a certain set of services, and there were several times where when we noticed an uptick in services being billed, particularly hearing from Medicare beneficiaries that they weren't getting their services, where we would investigate, shut down shadow offices and things along those lines. We also implemented a rule that was really looking at Medicare Advantage payments to make sure that the payments that were being provided to health plans were being paid properly. Those are a couple of examples. There are many more. There are offices at CMS as well as the IG's office that very much look at this. It is the responsibility of every administration to look and make sure dollars are used well. You just have to do it wisely. And the programs are are intricate, right? Like you really have to make sure you understand what you are doing if you make a change to payments. And so I would just say that my concern is the speed. I think that certainly looking, again, at payments is absolutely okay, but you need to make sure that you're doing it with knowledge about what these programs do and a real understanding that if you make a tweak here, you can really have a significant effect on people. Because this is real money, right? Like Medicare is over $1 trillion. Medicaid is 800 plus, right? This is very tied to the livelihood of the American people.
What would you do if you were still administrator, and you had any type of all the resources that you would like to kind of rein in some of this fraud and waste?
Well, I again, you're never going to get, you never can completely eliminate people doing things that they should not do. But I think that continuing to be able to investigate situations, right? So really making sure, as I said, one of the things that I was particularly focused on is, do we have providers billing for things and people are not getting those? And that's just something that we started to see. And I think that we're going to continue to see tools that may be helpful for chasing down improper payments. But again, you have to do these things carefully because you don't want to, when you're trying to shut down fraud in one area, eliminate people's ability to get care. And that's something we saw particularly in home health, where we saw an uptick in people not getting the services. But then at the same time, you have to make sure that people who are getting the services continue to do so.
I wanted to talk to you about health equity, which was a major pillar and goal during your time as administrator. There was a lot of new regulations, requirements for different facets of the healthcare industry, insurers and providers. Right now we have an executive order against DEI. Are you concerned that your work is going to be dismantled by this new administration?
I would say a couple of things. It was really important to me that as we think about and talk about health equity, to be very concrete about what the goal, what the purpose is. And what I would say is that policymakers often will try to do things, try to do the right things. You have to make sure that when you are implementing policy, that you look at how everybody is being impacted by that. And that requires asking certain questions. And that was a lot of our focus. So for instance, we had a diabetes program. Black and brown people disproportionately suffer from diabetes. There were no Black and brown people enrolled in the diabetes program. We need to ask these questions. So what do we need to do to make sure that we're creating programs that really attract everybody that needs to benefit? And I think that by asking those questions, it really got not just the government, but really outside stakeholders focused on those things, where they looked at their programs. We have disparities in our country, and I think that we have to be honest about even just knowing that these things exist, to make sure that we care about everyone. And it's not just, you don't just have to be selfless to say you should care about everybody. Again, I would say look at what happened with COVID-19 pandemic. If we don't care about the least among us, we all suffer. And so I think it's critical for everybody to really make sure we're trying to reach the underserved in our country.
Are you concerned do you think that the new administration shares that passion and goal?
I obviously cannot speak to what other policymakers are thinking, but I am concerned about the language that they're using, the removal of collecting certain data, of not being willing to again, really examine what's happening. We can't turn a blind eye to the problems in our healthcare system or across our nation and think that we're going to solve them.
Okay. So I wanted to chat with you also about the Medicare Advantage program, which has grown in enrollment during your tenure and is likely going to continue to grow, but there's been a lot of increased scrutiny during your tenure, particularly around overpayments, around marketing, and other things. What do you foresee as the future of this program?
Well, I would say from my perspective, I feel very agnostic about whether seniors, people with disabilities, and Medicare choose traditional Medicare or Medicare Advantage. I think what's really important is that everybody has that choice. And it's important that I think policymakers really make sure to preserve both of those programs. Medicare Advantage can be incredibly helpful for coordinating care, for receiving extra benefits. And there are things that Medicare Advantage is able to do that really traditional Medicare should be able to do. There are things that MA plans have been able to pay for that I think should have been and should be in traditional Medicare. And that's how we actually tried to use the Innovation Center to really provide some of those extra benefits. One that I'm particularly proud of is the guide model, which was really, it's designed for people with dementia to really provide some of the supports that you cannot provide in traditional Medicare. I think, though, we have to make sure that we're good stewards of Medicare Advantage. And there have been an increase in the payments over time. And so we took a close look at just making sure that those payments are justified and also that people are getting access to the care that they need. And so MA plans absolutely need to be making sure people can see their doctor. And so that is why there was a push for more transparency to make sure that the networks are adequate, because what we don't want is people enrolling in programs, getting extra benefits, which are great, but then not actually be able to see the doctors that they need to when they get sick.
Should DOGE take a hard look at MA?
I would say if they are looking at payments, absolutely.
Okay. I wanted to turn now, we only have a few minutes left, but I wanted to turn now to your potential successor, Dr. Oz. He is going through meetings with senators, likely going to have his confirmation hearing soon. Dr. Oz does not come from a CMS background. He is a doctor and was on TV, but unlike yourself and other former administrators who have you used to serve in HHS and also on Capitol Hill. So what would be your advice to Dr. Oz on his first day, should he get confirmed by the Senate?
Yeah, well, I would say that you as a leader are as great as your team. And again, I'm just so proud of what we were able to accomplish. And a lot of that had to do with the team of people that were around me and staff at the agency. And I would say to Dr. Oz, like really listening to outside perspectives. I think that it's so important to listen to stakeholders, to the people that provide care on the ground when you are making these decisions, because you don't always know how people are going to be impacted. And so that needs to be a constant conversation. So keeping the people that are served by the programs and the providers that provide care at the forefront is my best advice.
Okay, great. Well, thank you so much, and we're going to stop there. But former administrator, thank you so much for joining us today and for providing your insight. Let's give her a round of applause.